she's part of the Voxogo clinical trials. And you'll see different pictures of some of the other kids that have been involved in the trials as we go through the talk tonight. So I am Linda Polgreen. I am a pediatric endocrinologist at Harbor UCLA Medical Center, and we lost the slides. How about I bring them up and I can share? Give a second. Sorry, everybody, technical details. Or if someone else gets them up faster, feel free. Okay, sorry, it looks like somebody else is sharing now. Apologize, everybody. So once again, welcome. Hopefully that's the last technical difficulty we'll have. I'm Linda Polgreen. I'm a pediatric endocrinologist at Harbor UCLA Medical Center and an investigator at the Lundquist Institute. The Lundquist Institute is a nonprofit research institute in Torrance, California. And since moving out here to California and starting at the Lundquist Institute 7 years ago, I've been involved with Biomarin's clinical trial program as a site PI for the Voxogo clinical trials. And during that time, I have presented data from the different trials we've been doing at scientific conferences, but I'm especially excited tonight to talk about it because it is finally approved to be used in clinical practice. And now I'll let Rita introduce herself.
Hello, I'm Larita Manai. I go by Rita. I am a nurse manager at the Lundquist Institute. I've been here for 23 years, working on a variety of clinical trials. And in the last 7 years, I've been involved with Acondroplasia studies alongside Dr. Polgreen. On a personal note, I enjoy trying to teach my dog new tricks. It doesn't always work, but I keep trying. I also have an 8-year-old granddaughter that I drive a lot to many of her activities, something I'm sure most of you can relate to, right? So I just want to say I'm so excited to be part of this event, to share my knowledge about the injection, and my hope is that you'll learn something useful out of it. So again, welcome everyone, and let's get ready to hear from Dr. Polgreen.
All right, thank you, Rita. First, disclaimers. So the presentation is sponsored by Biomarin, and the speakers are being compensated for this presentation. The presentation, of course, is not intended for medical advice. We will be talking about Voxogo, how it's used, but for specific treatment questions on an individual basis, you really need to, of course, talk to your healthcare provider. So our overall goal for today's talk is to give you information on how Voxogo works, the potential benefits and side effects, and that is to help you determine if it's the right treatment choice for your child and family. We'll also be sharing an overview of available Biomarin patient support services. And finally, we'll have around 25 minutes at the end to answer any questions you may have. And as we're going through the presentation, you can enter these questions in the Q&A, but we will save all the questions until the end to give some answers to those. Just one note, certain topics might be out of the scope of this presentation, and other ones we just might not have time to get to. And so if your question doesn't get answered, we will give you a link at the end of the talk that you can contact Biomarin to have a representative get in touch with you to answer your questions. So let's start with some audience participation. All right. So I'd like to know, where did you first hear about Voxogo? So please put your answer in the chat box. It's mentioned the Q&A is just for questions, but for these audience participation, I'd like you to put your answer in the chat box. So did you hear about it on social media, internet search, advocacy group, friend or family member, my doctor, Biomarin representative, Biomarin email, or something completely else. And let's see, what are most people saying? So internet search, yep. So internet search seems to be the most common answer. I think that's how a lot of us find information these days. So all right, then let's move on and talk about how achondroplasia affects bones and growth. So there are two ways that bones develop and grow in the body, and one of those is called endochondral bone growth. So this type of bone is the type of bone that's affected in achondroplasia, and it's shown here in the orange. And the endochondral bone growth, the way it grows is that growth plates, which will be shown here in a second in purple. Thank you. So at the ends of these long bones, there's a cartilage growth plate. And it's that location where the bones grow in length and then the cartilage turns into bone. And it's in those locations that the bones are affected in achondroplasia. And at those growth plates, there are many factors that contribute to endochondral ossification or bone growth. Two of them that are particularly relevant for tonight's discussion are FGF and CMP. So FGF is fibroblast growth factor, and FGFR3 is the fibroblast growth factor receptor 3. And it's shown here in blue on the left. And signaling through that pathway slows bone growth. The other one on the right is a C-type natriuretic peptide, or CNP, and signaling through this pathway promotes bone growth. So there needs to be a nice balance between these two pathways for bones to grow properly. And in achondroplasia, there is a change in the FGFR3 receptor, which you can see here in the orange and red on the blue FGFR3 receptor. And when that happens, this change affects the FGFR3 signaling so that it's always turned on. So meaning that it's overactive, it's stimulating too much down that pathway, and that slows bone growth. And that's because although their body is making CMP, it can't make enough CMP to balance that increased FGFR3 signaling. And so because of that, that imbalance leads to the impaired growth throughout the body that you see in achondroplasia. All right, and now let's talk about Voxogo, what it is and how it works. So here's that same figure again with the FGFR3 on the left and CMP on the right, and this imbalance in achondroplasia between the increased signaling through FGFR3 and not enough CMP. And so what Voxogo does is it is a molecule that can also stimulate through the CMP pathway. And so it balances, it better balances, it might not perfectly, but it improves this balance between the increased FGFR3 and the CMP pathway. And so this improved balance should lead to improved bone growth. And what we found is that by increasing the signaling through the CMP pathway with Voxogo, that it does increase linear growth in children with achondroplasia who have open growth plates. And so what I mean by increased linear growth is just basically increasing in height over time. And it's important, I think, though, when we talk about whether or not to use Voxogo, that we think about what are the safety potential risks involved with it too. And whenever I talk to patients about risks, I like to really break it down to what would be the most serious side effects, and then what are the most common. And what we have found with Voxogo is that the most serious side effect we saw was just some temporary drops in blood pressure. And most of them are not symptomatic. They all resolved on their own without any significant intervention. But it is important to note that in the trial, we made sure that all the participants had eaten and drank at least 8 to 10 ounces of water or any kind of fluid within 1 hour of receiving Voxogo. And why that's important is that might be part of why we didn't see any more significant drops in blood pressure, but we don't know. That's just how it was done in the trial. And now let's talk about the most common side effects. So those are the most serious. Now the most common side effects, like with any subcutaneous injection, which is how Voxogo is given, so just beneath the skin. Injection site reactions were most common, and this includes redness and itching, swelling, bruising, and we'll go into a lot more detail for the safety issues a little bit later in the presentation. All right, but first, before we get into that, I'd like to see if I explained well enough how Voxogo works. So let's do audience participation again. Looks like there's a lot in the chat already. So how does Voxogo work? Does it A, block CMP signaling pathway, B, blocks FGFR3 signaling pathway, C, promotes CMP signaling, or D, promotes FGFR3 signaling pathway? And then that's great. I'm seeing a lot of C, which is the answer. Exactly. So promote CMP signaling pathway. So again, the same figure shown on the left here. When you have the increased signaling through the FGFR3 receptor, the body can't naturally compensate for that. So there's an imbalance there. And by adding Voxogo, you increase the signaling through the CMP pathway, better balancing that system. Okay, so now we're going to go over the results of the pivotal trial that led to the approval of Voxogo for treatment in kids with achondroplasia. So the clinical trial, what we call the pivotal, which is the one that the trial where the FDA's decision is primarily based on that trial. That's why we call it a pivotal trial. This was a trial of 121 children who were treated with either Voxogo or placebo over 1 year, and they ranged in age from 5 to 15 years with open growth plates, meaning the purple area that I showed you earlier was still there, was still able to grow. And this was a double-blind randomized placebo-controlled trial. And what that means is that the double-blind part means that nobody knew who was on treatment and who was on placebo. Placebo-controlled means that one of the groups did receive a daily injection that was basically like Voxogo, and nobody again knew or could tell, but it didn't have the medication in it. And so that's why you call it a placebo. And this was just 1-to-1, meaning a flip of a coin to decide who gets in one group versus the other. And so in doing that, there were 60 kids in the treatment group and 61 kids in the placebo group. And before we get on to the results from the trial, I just want to explain a little bit about what the primary outcome was in the studies. And the primary outcome was what's called annualized growth velocity. And what that means is it's a measure of how fast bones are growing over 1 year. So for everybody, whether they were measured at 2 weeks less than a year or 2 weeks more than a year, you calculate it out to be how much they would grow on average over 1 year. And that way you can compare each group. And so just to give you a simple example to make this maybe make a little more sense, if a child, for example, grew 1 inch in 6 months, then their annualized growth velocity would be 2 inches per year. So just doubling that since it's 12 and not 6 months. All right. And now the results. So what we found was that Voxogo helps improve growth rates in children with achondroplasia, again, age 5 years and older. And it's shown, the data are shown here in this figure on the left. Of note, just in case, some of you might have seen some other presentations or the package insert publications, they have previously talked in centimeters per year. For this presentation, it was changed to inches per year, but that's the reason why the actual numbers might look a little different than what you've seen before. But this here shows the changes in inches per year. And so again, on the y-axis, you've got the annualized growth velocity, so how much the children grew in a year. And baseline means that that's where they were called randomized, decided to the baseline before any treatment, whether it was Voxogo or placebo. So at baseline, both groups were growing pretty similar, but you can see over a year here, the placebo in this kind of purplish blue color, the line stays pretty flat. In contrast to Voxogo group, which is shown in pink, you can see the annualized growth velocity increases by about half an inch per year. So it goes from 1.68 inches per year up to 2.23 inches per year, compared to the placebo, where there really was not any change in the annualized growth rate. All right, and so the 60 kids that were in the Voxogo group in this first year of the trial were then, we've looked at their growth velocity, that annualized growth velocity, for an additional 1 year, because 58 of them did roll over into an extension study. And so this is an ongoing study now where they continue to receive treatment with Voxogo. The kids in the placebo, if they decide to go in the extension study, then they receive treatment as well. And we are following these kids until near final adult height to get some long-term safety and efficacy data. But what we found so far, in just looking at year 2, is that that increase in annualized growth velocity that I mentioned on the last slide did persist through year 2. So it was maintained. They continued to grow at that higher annualized growth velocity compared to what they grew at baseline. So those are the positive effects, you could say, that a Voxogo had on the kids. And so if we look at risks and benefits, so those are the benefits we've seen. And now we'll talk about some of the risks. And again, we'll divide this up in what are the potentially most serious risks. So might not be very common, but potentially serious. And then what are the most common risks? So first, the most serious, and this would be this potential for a decrease in blood pressure. And what you can see on the table here is that for decreased blood pressure in the placebo group, 3 of the 61 children, or 5%, had developed decreased blood pressure after their dose was given. And in 8 of the 60 children, or 13%, so a higher percent, of the kids treated with Voxogo had developed a temporary transient decreased blood pressure. And this decrease in blood pressure happened within 120 minutes, so within 2 hours of the injection, and they all resolved within 5 to 90 minutes. And there were only 2 of these that were actually requiring any sort of, that were symptomatic at all, I should say. And so as you can see here, it describes one of the patients who had the decrease in blood pressure developed some vomiting and another dizziness, compared to 0 of the 61 subjects in the placebo. So none of the episodes in the placebo group had any symptoms like that, but 2 in the treatment group did. And so again, it's just important as this drug gets rolled out to patients in the clinics, that people really understand that it's important to stay well hydrated and to eat within an hour of taking the medication. And now to go on to the most common side effects. And so that would be injection site reactions. And what you can see on the left, again, in this table, where they have the side effects in over 10% of the Voxogo patients, what we find is redness, swelling, some itching, hives at the site of injection. And if you look at the frequency over on the right here, there was a significantly higher number of these in the treatment group compared to placebo. So around 120, so on average, the kids with who were treated with Voxogo had 120 injection site reactions per child per year in 51 of the 60 kids. So almost all of them were having these about a third of the time over a year. And that's compared to the kids in the placebo, where they had 29 injection site reactions per child per year in 50 to 61 kids. So it's about the same number of kids had an injection site reaction, but the kids in the Voxogo group had many more injection site reactions per child. And so also I've only gone through what I'd say is the most serious, the most common. There's a lot of other side effects to consider. And so if you want to think further about treatment with Voxogo, I recommend you talk to your healthcare provider to discuss some of the other potential side effects. Okay, and then 2 kids did drop out of the trial, and one of them discontinued due to pain from the injections, and one discontinued due to a fear of needles. So both related to the daily subcutaneous injection. And now let's talk about how Voxogo is taken. As I mentioned, I think briefly earlier, it's a subcutaneous injection. It's given every day. You give it about the same time every day. And now I think what I'll do is hand this off to Rita, who will go into a lot more details about how it's taken.
Okay. All right. Thank you, Dr. Polgreen. So let's just take a moment and reflect on what we just heard. There's no need to share, but just think to yourself, what is the one thing you found interesting about the clinical trial data? So just want to remind you all, if something's unclear or if you have a question, please use the Q&A box to ask, and we'll try to cover it during our question and answer session at the end of the presentation. Okay, so you may be wondering, what can you expect if your family chooses to get started with Voxogo? As previously mentioned in the clinical trial overview, Voxogo is a once daily injection that's given just under the skin in the soft fatty areas of the body. The needle of the injection is very small, much like the insulin injection used by diabetics. The injection has a safety shield, which means the needle retracts automatically after the injection is given. Voxogo is also convenient in that the injections can be done from the comfort of your own home. You will be trained by a healthcare provider on how to give the injection, and that training will also get reinforced with the help of Biomarin's clinical coordinators who can provide you support at home. We understand that doing the injections on your own can be tough and scary, but we want you to know you are not alone. We'll talk more about the clinical coordinators and the support services Biomarin offers in just a little while. You can expect that your child will have regular measurements every 3 to 6 months after starting Voxogo. And as you start looking at the potential changes in your child's growth rate, please keep in mind that these measurements should be done on achondroplasia-specific growth charts. So you might be wondering, how long will your child take Voxogo? Next slide. Oh, did we lose our slides again? Okay, let's go into how long will your child take Voxogo? Thank you. And the answer is until growth plates close as indicated by your child's doctor. Voxogo helps to improve the rate of bone growth in children 5 years and older while the growth plates are still open. Having regular checkups with your child's prescribing doctor will help determine when your child's growth potential has been reached and when treatment should be stopped. So, how can you support your child when starting Voxogo? Take your time explaining the process so your child knows what to expect. Remember, this is something new for you and for your child, so be patient and take your time. In my experience, helping your child focus on something pleasant, such as watching a movie, a favorite toy, or singing a song really helps when it's time to give the injection. Talk about why it's important to take Voxogo and how it will help their bones to grow. We recognize that starting a new treatment plan can be challenging. Allow your child to help you plan and find a routine that works best for you and your family. In my experience, routines work and flow better when children are allowed to make decisions about things that affect them. And knowing what to expect helps. When talking with your child about the injection, use words like pressure or poke instead of pain or pinch. Get your family members to be around to help support and distract your child during the injection. Encourage your child to journal or use art to express their thoughts and feelings. And you always want to celebrate and praise your child every day they take their injection. Now, here's a really good question that might be a surprise to you. Does Biomarin offer one-to-one support to educate families? And the answer is a resounding yes. Let me introduce Christina McFadden, Biomarin's clinical coordinator, who will get into more details about this support.
Thank you so much, Rita. Can you all see me okay?
Yes.
Okay, fantastic. I am really excited to be here with all of you tonight and look forward to walking you through the Biomarin support services. Again, my name is Christina McFadden, and I'm one of the clinical coordinators at Biomarin. I have worked in this role for about 3 years. I'm a registered dietitian and certified diabetes educator, and have held various roles in the healthcare setting for over the past 20 years or so. When I'm not working, I'm spending time with my family. My husband and I have 2 kids. Our daughter is 10 and in the 4th grade, and our son is 8 and in the 2nd grade. One of our favorite things to do, especially this time of year, is to play games after dinner as a family. And really all types of games, board games, card games, charades, you name it. The kids' current obsession is the original 1980s version of Monopoly. I cannot tell you how many times we've played it recently, and it is a very long game. So with their school break coming up, I would love some new ideas. If you have any favorite games, please send them to me in the chat so we can retire the Monopoly, and any ideas would be much appreciated. Thank you. Oh, some are coming in the chat. Thank you so much. I can't even pronounce that one that just came through. Clue, very good one. So now that you've learned a little bit about me, I'm going to spend just a few minutes reviewing the Biomarin support services. Biomarin has a team of clinical coordinators and case managers that are here to support individuals and their families throughout the Voxogo journey. Our clinical coordinators are a team of medical professionals and will provide one-to-one support for children and families. Our goal is really to make sure that individuals feel confident when starting this new treatment and have a good understanding of what to expect. There are really 4 key areas that we provide support. The first being product education. Making sure individuals know how Voxogo works, how to administer, how to store the medicine, and so on. Injection reinforcement training. This support is provided both virtually and in person. Coordination medication shipments. Voxogo is supplied through specialty pharmacies. These pharmacies ship the medication right to your home. We can help you connect with them to ensure smooth coordination of medication shipments. And your clinical coordinator is there for ongoing support, including reminders for product refills, shipment updates, and anything else that might come up. The clinical coordinator team works closely with the Biomarin Rare Connections team. This team is comprised of case managers that provide one-to-one financial navigation assistance for Voxogo. They are truly the experts when it comes to the insurance process and understanding coverage options. They can identify financial assistance families may need, such as copay assistance where eligible. And just like the clinical coordinator program, their support is ongoing. So say, for example, there is an insurance coverage change. They're there to help to reduce any lapse in treatment by identifying options. And the team also works closely with the child's doctor throughout the insurance process to facilitate getting the necessary paperwork to the insurance company. Dr. Polgreen reviewed the side effects of Voxogo listed on this slide earlier on in this presentation. In addition to your child's healthcare provider, your Biomarin clinical coordinator will also review important safety information with you, including side effects. It's always important to tell your child's provider about their medical history and any medicines they may take. All right, well, I think we have asked you enough questions and provided hopefully a lot of great information. Let's take time to answer your questions. While we do our best to answer all of your questions, as Dr. Polgreen mentioned, certain topics might fall outside of our ability to answer, or we just might not have enough time. But don't worry, you've all been heard. And if you feel comfortable, we'll follow up for an appropriate way to reach you so that a representative from Biomarin can get your question answered. And again, just as a reminder, to ask your question, be sure to use the Q&A function along the bottom of your screen rather than the chat box. And feel free to mention who your question is intended for, Dr. Polgreen, Rita, or myself, Christina. All right, so let's get this Q&A started. Okay. Okay, it looks like our first question is for Dr. Polgreen. For how long should patients be treated with Voxogo?
Yeah, that's a question that comes up a lot. And so I guess the quick, easy answer would be until growth is done. Having said that, though, girls grow, whether they have achondroplasia or not, generally until about 15 years of age, and boys until about 17 years of age. And so that can be a very long treatment time. So when you ask how long should you be treated for, I would flip it and say, you could be treated until you're done growing around 15 to 17 years of age. But I guess I don't like the word should. And the way we know when kids are done growing is two things. So one is that we take an X-ray of the left hand. And in the left hand, kind of similar to like the figure I showed earlier with the purple growth plates and the orange areas of endochondral bone, there's growth plates in all of the fingers, all around all the bones in the hand. And they look like little dark lines between the bones when they're open. And when they close, all you see is the white bones. And so we can look at that X-ray and compare it to other kids to determine how open the growth plates are and about how much more growth is left. So that's the one way we determine to stop, when you would stop. The other one is how quickly you're growing. And so I'll tell you in clinical practice for other medications that increase linear growth, we use the bone age and then often a cutoff of 2 centimeters per year to indicate that that growth is nearing to be completed. But I think in skeletal dysplasias like achondroplasia, that cutoff is not going to be applicable and will need to be lower. But so it's those two things that we use.
Thank you, Dr. Polgreen. This is a question for Rita. This is a great question. How long does it take to incorporate Voxogo?
Child and family is different. So it may take several weeks or months to establish a routine. You want to think about your child and your family's schedule and see where giving the injection makes sense for you. Also, I think allowing your child to help you plan the daily routine, the schedule, and making decisions about their treatment plan, I think that goes a long way in helping you with your daily routine.
I love it. Thank you, Rita. Another question for Dr. Polgreen. For how long should patients be treated with Voxogo?
Oh, I think we just did that one.
Oh, I'm sorry.
It's okay. I can answer it again until their growth plates are closed and then their growth velocity is slow.
That's all right. For Rita, I have a follow-up question for you. How big is the needle? Does it hurt?
Good question. That's probably the most frequently asked question that I get from the kids and the families. The needle on the administration set, it's small. It's a 30 gauge by an 8mm needle, very similar to the insulin injections that diabetics use. Will it hurt? Well, you want to be truthful with your child and say, it may hurt, but it will only be a few seconds. You'll want to rotate the injection sites. During the trial, we used upper arms, the back of the arms, the upper thighs, and the abdomen. But during your training with your healthcare provider, they should go over that with you. All right, thank you.
Thank you, Rita. All right, Dr. Polgreen, what's the normal growth of a child with achondroplasia? Is it represented with the placebo group?
Yeah, so I think one thing to remember that I should have mentioned back on that slide was that when we talked about the growth rate, so about 1.6 inches per year in both groups at baseline before starting treatment, that's on average. And so kids grow at different rates at different times. Before puberty, they're growing slower. Once kids enter puberty, girls grow very quickly in the beginning of puberty and boys very quickly in the end of puberty, and then growth starts to slow. So to say how fast do kids with achondroplasia grow, well, that changes with age. And the numbers that we said of 1.6 inches per year, that is on average how fast kids with achondroplasia ages 5 to 15 were growing who participated in the study.
Thank you, Dr. Polgreen.
Mm-hmm.
Another question that came in, this is fantastic. We're getting a lot of questions in the Q&A.
Mm-hmm.
I'm concerned that our doctors are not in favor of this, our genetic doctor. They keep emphasizing that the growth is minimal. Can they choose not to prescribe this? And I'll throw this out to either you or Rita.
Yeah, I can, so it's a kind of a complicated question. In terms of, I was just looking at it and now it moved, but it's in terms of the 0.5 inches per year. I'll start there, I guess, that I mentioned, and saying, it doesn't sound like much. I think it's important to remember that that's only over 1 year. And so when you think about, and we don't know for sure how many years that increased growth velocity will last at this point. So far, we know over 2 years, the growth rate stayed an extra 0.5 inches per year higher on average. So that, that just accumulates over time. So it's not that once you reach your final adult height, you only have increased your height by 0.5 inches. That continued so far, at least after 2 years, it does seem to be maintained at that higher velocity. And so, but again, people grow at different rates. We get asked all the time in clinical care to predict the response. For example, when kids are starting growth hormone, often we are asked, well, how much taller will my child be if we start this? And it's always really hard to say. We can give general estimates, but it's hard to predict and it takes time. But what we know so far with Voxogo is that over 2 years, the growth velocity did maintain that increase of a 0.5 inch per year. But there's more to that question, right? There was about the physician not wanting to prescribe it.
Mm-hmm.
And what was the other part? Just make sure we answered it for them. Oh, here, I just found it. Yeah, can they choose not to prescribe this? And clearly, yes, they can choose not to prescribe this. And if it's something that you want to consider more, then unfortunately, you might need to talk to another provider. But I would encourage you to first keep talking with the provider you're already with about what you want and what you've learned, and continue the discussion with them since you have a relationship with them. But in the end, they can choose to not prescribe it.
Dr. Polgreen and Rita, I will give you a little break. I will take this question. So this question has come up. Will insurance companies provide coverage for Voxogo? So we anticipate Voxogo will be covered due to the unmet need and no FDA approved treatments for those with achondroplasia. Once you receive a prescription and are enrolled in Biomarin Vera Connections, a clinical coordinator will reach out to discuss your insurance coverage and financial options for gaining access to Voxogo. And Biomarin provides these services at no cost as part of Biomarin's patient support program. That question has come up a few times. All right, let's see here. For Dr. Polgreen, does Voxogo change my child's bones, growth plates, FGFR signaling, or genes?
All right. So Voxogo bones, yes, I would say Voxogo changes the bones because it increases the linear growth at the growth plate in the bone. It does not change the FGFR3 receptor because it does not act through that pathway. Again, it acts through a CMP signaling pathway to put the brakes on downstream from the FGFR3 signaling pathway to kind of kink it. So there's not so much, put the brakes is a good way to say it, I guess. So it's not so overstimulating, but it doesn't affect the receptor itself. I think you asked, does it affect the genes also? And there, no, the CMP Voxogo does not go into the DNA, so it does not affect the genes or change your genes or the DNA in any way. And did I cover? I thought there was a fourth. I think that was all, maybe.
I think you're good.
Okay.
Dr. Polgreen, why is the injection site reaction so high?
Yeah, you know, it's to me, it's not high. It's kind of, because in my clinical experience, prescribing different subcutaneous injections, it's not uncommon to have a little redness, a little swelling with a variety of different subcutaneous medications. And I don't know if it's necessarily the medication or sometimes it's the carrier that the medication is in, but to me, it didn't strike me as being unusual. Compared to other medications that we prescribe that are subcutaneous. The frequency didn't and the extent. So they were all pretty mild as well.
Great, thank you. Rita, what is the best time for injection? Early morning, late evening?
It's funny, I was just answering that. There is really no set time. That all depends on you and your family. The important thing to remember is once you select a time or a routine, try to stick with that. You want to try to give the medication the same time every day as much as possible.
Thank you, Rita.
You're welcome.
Another question for you, Rita. Do the injections cause scar tissue to build up?
During the trial, I have not found that in any of the children that I've worked with. So that's something interesting. I haven't found that at all. Dr. Polgreen, have you come across that?
No, I haven't either.
Yeah, not for this study.
We have a lot of injection related questions. Is the injection injected quickly or slowly?
It's such a tiny amount of liquid or medication in the syringe. You don't want to give it so slowly, but you don't want to jam it in there either. So just nice pressure. And again, when you get your training with the healthcare provider, you can discuss that with the healthcare provider as well.
Thank you, Rita.
Mm-hmm.
Dr. Polgreen, can a 16-year-old female be treated if her growth plates are still open?
Short answer, yes. So if growth plates are open, then yes. So age 5 and older with open growth plates. The long answer would be that I think there should be a discussion in that case with their healthcare provider about risks and benefits. If she's 15, she's unlikely to have much time to grow left, even if her growth plates are still open. And so that's where it's really needs to be individualized to that patient of how much benefit can they expect by just a year or two before the growth plates are closed, and growth is normally slowing at that age anyway. And is that worth it for the daily injections? And that's just an individual treatment choice.
Thank you, Dr. Polgreen.
Mhm.
Dr. Polgreen, and a question about risk factors. Are there any risk factors or medical or developmental factors that preclude a child from being a candidate for the treatment?
Yeah, so risk factors, I think, would really revolve around the blood pressure issue. And so if a child already has a problem that causes them to have low blood pressure, be at risk for low blood pressure, then that would be somebody that you would really think twice about before treating with this, because that is the one potentially serious risks that we followed very closely and that we did find some kids have. Again, though, I think for all those sorts of questions of can a kid with this disease be treated, or this disease, that is a discussion that needs to be had with the patient's healthcare provider ultimately to go through the full history.
Thank you. Dr. Polgren, does the dosage change over time, or will it be the same amount of medication?
Yeah, so the dose, the kind of, when you think of per kilo dosing, stayed the same generally. In the trial I discussed, the dose stayed the same in terms of the per kilogram, or the amount per weight. But as kids grow and gain weight, then the actual dose itself increases because they're heavier, and so then the dose increases. I don't know, Rita, can you explain that a little better? I don't know if I made that very clear.
Can you repeat that? I'm sorry.
It's about the dose changing. So how, the total dose changes as they get bigger, but the dose in per kilogram stays the same. Maybe you can talk about volume, because that kind of goes up and down.
It did as the dose changed some.
Yeah.
I mean, the volume, it's still a small amount of volume.
Yeah, and it comes in 3 concentrations. It will come in 3 concentrations.
Yes.
And so there's the actual volume, I don't think ever gets above, I think it was about 0.6 mils there in the package insert. Yeah.
Very
so
easy.
that's very tolerable.
Thank you both. Rita, are the injections done in various spots to avoid injection-related side effects, or to spread around the treatment to the growth plates in different parts of the body?
Are you talking about the injection sites and where they're given?
I believe that's the question. Yep.
Yeah, so you want to rotate where you give the injections. So during the trial, they're given in the upper arms. You can rotate right, left. You can go from your upper thighs, right and left, and also the abdomen. So that's the area that most parents gave the injections. So yeah, a good idea to rotate the sites.
Okay. All right, here.
But it's not for getting it to the bones. I think that was part of the question too.
Mm-hmm.
It'll get there whichever site you use.
Yes.
A question about what was seen in the trial. Dr. Polgren, how often were the 2 kids who were vomiting in the studies? Was it a single occurrence, or did it happen multiple times?
I believe. So I know that the dizziness I know is very short. The vomiting, I don't know exactly how many times, but I know it was very limited as well, and resolved without any interventions. And so it wasn't that it was a protracted ongoing vomiting. They were all very temporary, short reactions.
Thank you, Dr. Polgren.
Mm-hmm.
There are several questions still unanswered, so I'm doing my best to filter through these. Okay, this is a good question, Rita.
Mm-hmm.
Psychologically or otherwise, are there any benefits/disadvantages of administering the drug while the child is asleep?
I would not say anything psychologically about it. Depending on the child, some people have given it while they're sleeping. I mean, I don't, during the trial, I don't think there was anything psychologically or problematic about it being given while the child's asleep.
Mm-hmm. Yeah. I can say in clinical practice, in part, like Rita said, it depends on the age. So I think, a kid who wakes up while you're standing over them with a needle, that's going to be very upsetting to certain age kids.
Yes.
Other kids, they don't want to know about it. Just do it while I'm sleeping so I don't feel it.
Yeah.
So it's very kid dependent. Yeah.
Right.
Great. And I'm just going to clarify about storage for Voxogo. So it can be stored at room temperature for 90 days.
Okay.
Wanted to clarify that. All right. This is Dr. Polgreen. Does CNP play any other role in the body?
Yeah, so it's a natriuretic peptide. That's the NP part, and there are other natriuretic peptides, brain natriuretic peptide, atrial natriuretic peptide, and so what that means is that it promotes salt loss in the kidneys. That's what natriuretic means, and so it does work on different areas there in terms of sodium balance, but we didn't see any problems with that either, with the sodium and electrolytes in the blood.
All right, I think we have time for maybe one or two more. Let's see here. Does this, Dr. Polgreen, does this provide growth in legs and arms or height only?
It's a good question. So all we have shown from this phase 3 trial, the data I showed you here, was in height, and so standing height. And we did measures throughout the study, as Rita well knows, worked with the bionutritionist doing these for arm span to get data to answer the question about, does it impact arm length as well as height? We did sitting heights also to look at, is it affecting the growth in the legs as much as affecting the growth in the upper body, and have looked at proportionality. So meaning what is the proportion of the top part of the body to the lower part, the legs? Because in achondroplasia, the top part of the body, top portion is taller than in kids without achondroplasia relative to the bottom. So call it a disproportionate short stature, where versus a proportionate short stature. In the trials, in just the limited amount of follow-up time we have, so in the year, this data that I mentioned, we did not see any significant changes in that proportionality. So getting at this question of, did the spine grow more or less? They didn't get more, the proportionality didn't get worse and didn't improve. It just stayed about the same. But it's something that we are continuing to monitor in the extension trials, both the proportionality and the different effects on arm length versus leg length as well.
Okay, let's see. I think we have time for another question. Dr. Polgreen or Rita, can Voxogo be given when a child is sick or unwell? What if we missed any of the days?
That'll be a Dr. Polgreen question.
Okay. So yes, there again, it's something I'll say yes is the short, but it's something that you need to talk with your healthcare provider about, because it really depends on the unique situation of why they're sick. So, for example, if somebody is sick with something that causes a drop in blood pressure, then maybe you'd want to hold it. I would say I would lean more towards holding than not holding, because there's no harm to missing a few days. And so, but if a child has a cold, you can still give Voxogo. If they get a vaccine and they're having a fever, you can still give Voxogo. But for more in detail discussions about that, it needs to be personalized on a one-on-one level.
Thank you. Thank you so much, Dr. Polgreen and Rita. We have just a few minutes. I want to thank everyone for all of their questions, all of their engagement. Thank you all for joining us tonight. Again, big thank you to Rita, Dr. Polgreen, for sharing all of your knowledge of Voxogo with all of us. I'm going to turn it over to you, Dr. Polgreen, for final comments and to close out the event.
All right. Oh, and I was going to tell you about a game.
Oh,
Christina, I was thinking about Kids Create Absurdity.
Oh, I have
It's
not heard that one.
My daughter's 8, and we've been having a lot of fun with that one after dinner too.
Thank you so much. I'll have to look that one up.
All right. Well, again, thank you, everybody. I know we didn't get to everybody's questions. And so if yours was one we didn't get to, please, you can contact Biomarin again here with the scanning the QR or the website there. And of course, talk with your local physicians about your questions as well. There's a lot of information out there now and available to them. And so it's a really good resource for you. So just quickly to summarize, we've gone over what Voxogo is used for. We've talked about safety in terms of what's the most potentially serious and what's the most common side effects, and how it's taken as a subcutaneous daily injection. And before we go, just one last question that we'd like you to think about, and that is, what is one thing you might do after hearing this presentation? And you can type it in the chat or just think about it on your own. But either way, thank you so much for joining us this evening, and have a wonderful night. Thank you.
Thank you, everybody.
Thank you, everyone.
Bye, everybody.